Welcome, everyone. We are really excited you're with us today. This is our third session of our Navigating Cancer Survivorship Wellness Series, our third of four. So I will say the next one is on June 3rd, and it's a two-part series on sexual health and cancer survivorship. So both A Breath of Hope and MOCA have that online to register. And so we're excited. MOCA, I should introduce myself. I'm Stephanie Gliniani. I know all of you in person know who I am, but we do have people joining virtually too. But we are partnering with A Breath of Hope for this and just really excited about this partnership. We have a great session today with two wonderful speakers on nutrition and exercise. And so we're going to start with Sarah, and I'll do a little intro to her too, but we'll have 45 minutes with Sarah, which will also be a Q&A, and then we'll hear from Claire for the last 45 minutes, which will be really nice. So if you do have questions, feel free to jot them down. For people online, you can send your questions in. And so I will introduce Sarah. She's going to start us off. Sarah is a registered dietitian with Minnesota Oncology, and she has been working with oncology patients since 2012. So I will welcome Sarah for her part of the presentation. So thank you for being here.
Thank you. Yeah. That's an older picture of me. I apologize. I feel like I'm that age still, but I look different. It's fine. Okay, so do I just push this button click? Okay.
Yeah, the arrow. Oh, sorry, to the right of the circle. There's more arrows.
I got you. I'm sorry.
I can do it. I've just used it a bunch of times.
Okay. So nutrition is obviously an important part of everyone's journey, and especially in somebody who has a diagnosis of cancer. And not only is it important for people who are in a treatment phase, but also in a prevention or risk reduction phase. So I'm going to go through a little bit of both of those aspects today. And just know that nothing does not have to be perfect. Diet does not have to be perfect all the time. You do the best you can. I always say, and I'll kind of give you guys some takeaways, but I always say if the food looks recognizable and has ingredients that maybe your great grandmother would recognize in the kitchen, it's probably going to be recognized well in your body. But then you'll also hear me say 80-20. 80% of the time you nourish your body, 20% of the time you nourish your soul. So it's all what you do, on an everyday basis that matters most. So why is nutrition important? Everybody will have abnormal cells in their body at some point in time in their life, whether it's been exposure to environment, or maybe if you've been around somebody who's smoked, or maybe you just have different free radicals that have damaged your cells. It happens with everybody, but what happens with cancer is it's kind of a perfect storm where they're gathering nutrition, they're gathering energy, they're gathering things to help it replicate, and then it becomes a cancer tumor or cancer of some kind. So there's many factors that influence these cells to change, and some of them are something that can be changed and controlled, and some things cannot. Nutrition, stress, and lifestyle are the kinds of things that can help to reduce risk of change in your cells, whereas genetics and of course, there's unknowns out there. You could be the healthiest person and still develop cancer, and there's going to be some unknowns always that can cause abnormal cells in cancer too. And I'm not going to go bore you with the science of it, but initially, essentially what cancers do is our cells, every cell kind of replicates. It has 3 different phases. Nutrition plays a role in all 3 of those phases. So one thing I always tell people is, for example, if you have an abnormal cell in your breast tissue, if you eat broccoli and the family of broccoli, the cruciferous vegetables, cabbage, Brussels sprouts, things like that, there's compound in there that will find that abnormal cell and either destroy it or repair it. And that's just one example of what nutrition does. So if the way we eat can help, there's different compounds in every food that we eat. Some of them work together as a team and help each other out. For example, lemon in green tea. If you have that balance of lemon and green tea, there's compounds in each that help give you that antioxidant that you need to repair that cell or get rid of it. Okay. So diet, a diet that is rich in fruits and vegetables and plants is going to be the best way to incorporate some of those compounds so that you can repair and or prevent cancer and or support your immune system while you're going through treatment. Today I'm going to go through, like I said, both kind of a survivorship. Actually, the definition of survivorship in cancer is right after diagnosis. Everybody is in survivorship. But I'm going to touch on briefly some of the things that can happen during treatment and how to manage that, as I know that there are different people in here that are at different phases. But I'm also going to go through wellness and how to use nutrition for your benefit. So the view of like a healthy diet for most cancer types is kind of like a Mediterranean style or anti-inflammatory diet. In fact, it's healthy for a lot of chronic illnesses. So lots of fruits and vegetables, healthy fats, whole grains, fiber, things like that. Of course, if you are going through active treatment, sometimes it's difficult to manage that kind of a diet. We don't expect people to follow that diet perfectly while they're going through treatment because it can cause more problems. So these are some of the side effects that are typical of somebody who's going through active treatment. You kind of see the writing, it's a little bit small writing, but I'll go through that. Some of the typical treatment challenges include fatigue, taste changes, appetite changes, nausea, vomiting, constipation, diarrhea, and then unintentional weight changes. The goal, ultimately, especially for people who have ovarian or lung cancer, is to maintain your weight as much as possible while you're going through treatment. Sometimes I have patients who say, I have a lot of weight to lose. This is actually good, but it's not. That's not the case. Sometimes in certain situations, upwards of 60% of weight loss is muscle mass, and that can directly impact how you're tolerating your treatment. It also impacts your ability to support your immune system. Okay, so we want to maintain the weight. So if you have that view of the Mediterranean or anti-inflammatory diet and you're trying to follow that as best as you can, great. But there may be a period of time between cycles of treatment where you have to make modifications. So for example, if the bitterness of some of those greens, those broccoli, Brussels sprouts, are too much for you to handle, then you may not be able to eat them. Try to choose things that have more of a sweeter flavor, or maybe add some lemon to the broccoli and see if that helps. If you're having issues with appetite and eating a big salad is ideal, probably you're burning a lot of calories while going through treatment. That's a lot of volume for somebody to eat with trying to meet their calorie protein needs. You may have to go with more dense things like mashed potatoes, maybe sweet potatoes. Lots of protein is also ideal. So trying things that might be a little bit more easy to tolerate, a little bit comforting. Digestive issues, nausea, vomiting, we always recommend small, frequent meals, utilizing ginger, trying to have bland things, maybe things that don't have a lot of smell, tends to help. I always tell people, try to engage your health providers early so that we can provide medications to help manage these things too. Because sometimes diet just doesn't do it for everybody. And then try to avoid gas-producing foods if you're having diarrhea or constipation. And of course, if you are having diarrhea, the definition of that is 3 or more urgent stools daily, watery or loose. Again, we're not going to probably do a lot of those broccoli, Brussels sprouts, cabbage, because those are very gassy types of foods, and they tend to increase transit time for digestion. So bottom line is we want to try to kind of meet you where you're at and what are the symptoms you're experiencing and make modifications based on that. When you're feeling better, you transition back to that Mediterranean / anti-inflammatory kind of diet. Welcome. So the treatment takeaways is to eat regularly, nourish your body, small frequent meals. It's okay if choices are not perfect. Try to consume protein at all 3 meals if you can, or all meals and snacks, because protein helps to support your immune system, also helps to support muscle mass. Try to be physically active. A lot of the studies have found that if you can maintain your physical activity that's typical for you, or try to incorporate some physical activity during treatment, it actually helps to reduce a lot of the fatigue. People have a better quality of life. You don't have to go to a gym, but any kind of movement is great. Try to maintain social connections around meals because it helps to improve appetite. Ask for help early. Like I said, try to discuss this with care providers so that they're aware and can help with medications that might be needed. And then avoid nutrition overload online. You can deep dive into a rabbit hole online, and a large amount of it is either going to make you more stressed out or maybe it's just inaccurate. Okay, so we're going to move to a little bit of survivorship and wellness, and I'm going to have somebody just go like this or just give me a heads up because I could chat all day. So just make sure that I'm staying on track, okay? Okay, so what I'm going to go through today is some of the suggestions based on research and what is found by the American Institute of Cancer Research, as well as the American Cancer Society. They've combined a bunch of research articles about nutrition and physical activity and lifestyle and how to reduce your risk to promote better wellness. So there's all these different recommendations of what to do for those people. Number one is weight. You want to try to get your BMI to a point where it's not underweight and not overweight. But there is a caveat to that. But I'll put a pin in that and I'll tell you about it in a minute. We want to try to get your BMI to this normal or healthy weight as much as possible. I don't know how to do the weight. So right here is where most people want to be. If you are older than 65, however, you're going to want to be in this stage. After 65, being in that overweight stage is better because a lot of times if you do come down with some kind of higher metabolizing cancer, there's risk of people losing too much weight. And at that age, if you're a little bit overweight, you do have a little bit of wiggle room then with your weight if you're losing it, okay? So a lot of the research has found that if you're of 65 age and older, it's actually a little bit better to be on that overweight stage. Physical activity is a huge, huge reduction in risk for cancer and other chronic illnesses. It helps with not only cancer, but Alzheimer's and diabetes and high blood pressure. All of these things are impacted and improved with physical activity. What that looks like to you depends on where you're at in your life. We don't expect everybody to go to, a CrossFit gym and doing like crazy workouts. You got to kind of see where you're at and work with that and maybe slowly incorporate new exercises. But the American College of Sports Medicine has recommended that you do at least 150 minutes of moderate intensity exercise. So that's like walking. Maybe you can say the ABCs, but you get a little bit winded. You have to take a couple breaths between your letters. Or 75 minutes of vigorous intensity per week. Those are the recommendations. Either or. Okay. And you want to try to use strength training at least 2 days a week because that not only helps to build muscle, strength training builds muscle, but it also protects your joints, protects your bones, speeds your metabolism up if you need to have weight management as part of your goal. So you want to try to incorporate that as well. Physical activity is important. They do say sitting is the new smoking. Part of the reason they say that is because a lot of people are sitting most of the time in their work. They're using the computer. They're not getting up and moving, maybe for hours during the day. And it has increased risk of a lot of different illnesses because of that. Physical activity over and above usual activities. So physical activity, if you're very active in your normal work, you do have to make sure you're getting up and exercising, doing something beyond that as well. Okay? You can start as little as 10 minutes a day. I have a patient who walks 3 laps in his driveway. That's what he started with. I'll take it. Okay? Nutrition intake. This is kind of going towards that anti-inflammatory diet or Mediterranean style diet. Okay? Plants. I always say to people, good, better, best. Plants are 5 to 9 servings of vegetables a day is the optimal. So if we're talking good, better, best, that's the best. 5 to 9 servings of vegetables and fruits daily. Half a cup of cooked, which is about the size of my palm, or a cup of raw, which is the size of my fist. Okay? If you're not really doing that much right now, good would be 1 vegetable and fruit a day. Better would be 1 fruit or vegetable per meal. Best would be 5 to 9 servings a day. Okay? Again, see where you're at, Work with what you are comfortable doing, even if you just increase by 1 serving a day. Doesn't matter if it's cooked, raw, get a variety, okay? Choose food and beverages in amounts that are promote healthy weight. We'll kind of go through a little bit more of this, but you're drinking a lot of sugary drinks that tends to cause a lot more issues with blood sugar, which can affect your risk factors. Choose whole grains instead of refined grain products. Essentially looking at what is in the middle of the grocery aisles tends to be more refined. Limit consumption of alcohol for women, no more than 1 serving, no more than twice a week for alcohol, okay? And as little as you can. Certain cancers, if you're drinking alcohol on a regular basis, can increase your risk by 30% of recurrence. It is metabolized by your liver, and your liver is in charge of getting rid of abnormal cells. So that's part of the reason. Limit sodium intake and processed food intake. You can have some salt, but make sure that you're minimizing some of the processed foods, which have a lot more salt in it. So again, plant-based diet, I kind of went through some of this already, but does that mean vegetarian? No. Good, better, best. Try to get some fruits and vegetables in daily. 5 to 9 servings, like I said, is kind of the optimal. Choose a wide variety of colors. As I said earlier about the compounds in broccoli, they're different in the compounds in tomatoes, which are different in the compounds of carrots and sweet potatoes. But try to get a good variety. Then you provide fiber. And fiber is also found in nuts and seeds. It's also found in whole grains like farro and quinoa. So when I say plant-based diet, it also includes that kind of stuff too. For women, 25 grams of fiber is important, even upwards of 30 grams of fiber per day. Do not start there. Slowly incorporate more fiber. Because if you're getting maybe 5 grams a day and go to 25, you're going to be calling and talking about Sarah and how she told us to get 25 grams of fiber, and I'm in terrible pain. Please just make it slow. Okay. Beans and legumes are awesome. Oats, and then again, nuts and seeds, also rich in fiber. So if you're having yogurt, put some chia seeds in there. Mix it up, let it sit for a little bit. It'll kind of swell and give you a little extra fiber. Having oats in the morning, you can do overnight oats if you want to. Adding beans to your salads, great ways to incorporate more fiber. Prioritize protein. As I said, protein is important, definitely during treatment, but also in the risk reduction phase. As we age, it just helps to improve our immunity, helps to improve our muscle mass. It's good for like healing too. So if you have any wounds, it can help with heal that too. Targets for protein. I always tell people try to eat protein with each meal and snack if possible, especially if you are having carbs. I'm not going to go into this in depth, but protein, when you're eating them with carbs, it actually helps manage blood sugar reactions, which is good. So if you're just eating a whole bunch of carbs, your blood sugar could spike. If you add protein to that, especially if it's fiber-containing carbs, it's much better management of blood sugars, okay? And as you can see there, are you guys going to get copies? Yeah, perfect. Just in case you can't read that, it's just animal products. Greek yogurt, eggs, cottage cheese, chicken, fish, turkey, beans, and legumes, protein shakes. Healthy fats. Healthy fats are important for reducing inflammation in the body. It's okay to have fat. There was a period in time where fat was really evil. No longer is this the case. I am of the SnackWell and like life. I'm sure somebody else who knows about the SnackWell cookies. Remember that phase? Everything was fat-free. Problems. Fat is healthy. It actually helps to nourish your brain, helps to nourish your ability to kind of think and be critical about different things. It helps with your joints. It helps metabolize things too. So omega-3 fatty acids, olive oil, nuts and seeds, and avocado are all excellent sources of fat. Inflammation, what is it? Does anyone know what inflammation is or how it presents itself? There's a marker in your body that is kind of like how you can identify if you have inflammation, but it shows up. CRP. Sure. It can show up as joint pain. It can show up as digestive issues. It can show up as brain fog, various things. So if we can help to reduce some of that inflammation, what causes it? You know, it could be stress, could be the reaction of some certain medications causing inflammation in certain disease states. So we want to try to reduce that as much as you possibly can. How am I doing with that?
I don't even know. I'm too involved. 4:23.
Okay.
Yeah, you got 25 minutes.
Oh, cool. Okay, hydration. Hydration is also important. It helps with blood pressure. It helps with bowels. It helps to improve energy. Hydration is a really important thing. I know everybody's walking around with water these days. I see it all over here. If you are dehydrated, particularly during treatment, it's likely part of the contribution to fatigue that you're having. Fatigue is a very common side effect, but if you're dehydrated, it makes it worse. Kind of feels like almost like fluish, almost like your body aches and things like that, but also makes you feel very fatigued if you're dehydrated. So if you ever have that lull in the afternoon, look back at what you drank during the day. Are you dehydrated? Maybe drink some water. Maybe go for a 5-minute walk. Your energy will change. Okay. The other thing to keep in mind is if you are trying to support your immune system, and your immune system, of course, is red blood cells and white blood cells and things like that, your body doesn't have to work as hard if you're hydrating your blood. Okay? If your blood is thicker because it's dehydrated, it's a lot harder for your heart to pump it through to get things kind of improved. Okay? Plus, you're supporting your kidneys then. Okay? By the way, I'm going to go back. Hydration, not just from water. You can get hydration from broth. You can get hydration from like a decaf tea, decaf coffee. Caffeine is dehydrating, is particularly if you have a lot of it, and alcohol is dehydrating. So you can get hydration from other sources too. Okay. Okay, so specifically for lung cancer survivorship, there's a couple things to consider if you're trying to do some risk reduction. Number one is kind of an obvious one. Smoking cessation. It's kind of it's a very challenging thing for people. However, it does reduce risk quite a bit if you can do some smoking cessation programs. But nutrition also plays a role. The diet that's kind of Mediterranean style diet where it's rich in plants and healthy fats helps to reduce that inflammation again and helps to boost immunity. Okay, so we've been talking about that already. But also something that we haven't been talking about is supplements. I will kind of go through that. One particular supplement is called beta carotene or vitamin A. And in people who take high dose beta carotene supplements, if they are a smoker currently or have smoked in their life, it actually significantly increases the risk of recurrence of lung cancer. So that's something to keep in mind for that. Also muscle maintenance and fatigue management. So making sure you're getting that protein intake. I feel like I am repeating myself, but protein helps with, again, with supporting muscle mass, including the lungs, okay? And helps to incorporate, just in general, it reduces fatigue and helps better quality of life. For ovarian, depending on the stage you are in, ovarian cancer can be very challenging in terms of allowing people to eat normally. A lot of times people have like early satiety is what I call it, where they're feeling full quickly, depending on where they've had their tumor or where they've gotten it treated. So I always try to help incorporate different methods to help these people eat a little bit more during the day. But because of some of the medications, because of the hormone changes, because of various things, there is a little bit higher risk for bone health, for the depleted bone health. So we want to make sure that people are getting adequate amounts of nutrition for their bones. One of them would be calcium, vitamin D. Those are okay to supplement. Make sure you talk to a provider or dietitian to help with dosing, depending on where you're at. But also weight-bearing exercise helps to support bone health. Okay, that is one way that people can do something significantly to help with bone health is exercise. Okay. Again, digestive comfort is something that I discuss because people do have a lot of difficulties with digestion. So I talk about, again, gradual fiber intake, but small frequent meals, and looking at what quality in terms of foods that they're eating to see if there's anything we can make modifications of. And then again, balanced plant-based forward, plant-forward diet is what I recommend. Do I have any questions so far? I'm going to go over some of the frequently asked questions that I typically encounter. So less common in lung and ovarian cancer, but might be something that you're interested in is soy. A lot of times people with hormone-based cancers wonder if they should be avoiding soy. Soy kind of got a bad rap because of the fact that it's called a phytoestrogen. But in fact, phytoestrogens are very beneficial. And when you're having a phytoestrogen, it actually protects your body from having a more of the more aggressive estrogen from being able to bind to estrogen receptor sites, causing tumor growth. So it is actually a beneficial thing. But there's a lot of processed foods out there and a lot of processed soy-based foods out there. Soy is a very cheap protein, and it's been processed in various ways. So you might find protein bars that have soy protein isolate. You might find nuggets that are vegetarian-based but have soy protein isolate. You'll see those three words, soy protein isolate, commonly when something that's not naturally a source of protein has protein. Okay, so cereal with protein. I'm not going to pick on Cheerios, but like Cheerios with protein. Or, because I don't even know if it's soy protein in that one, but that's kind of a good example. Or if you have like waffles with protein. You know, you have to take a look. What kind of protein powder are they using? Soy protein isolate has been known to cause abnormal cells in animal studies. So try to get the least processed soy foods if you can. Soy milk, soybeans, tofu, miso, soy nuts. Try to incorporate them in your diet. Do you have to? No. It is just one aspect of what you can do to help with risk reduction, but you don't have to. This is just one method.
So like I'm interested like the miso soup. I've never made it. Like do you buy like the paste or like how do you like to buy it?
Miso paste. Yes.
Paste. So a lot of the products that are out now that say they're protein because it's such a buzzword right now.
Yeah.
Are they using this type of soy in those refined products that are being marketed to a lot of young children, quite frankly?
Yes, the question was some of the ingredients, you know, are they using a lot of soy protein in some of these products? You kind of have to look. It's not always soy protein. Sometimes they use chickpea protein, which is actually kind of a good one. Pea protein, they use kind of like milk-based or whey-based protein. So it all kind of depends on looking at the ingredients and, you know, where they're getting that from. But of course, they use a lot of the soy protein because, again, it's kind of an inexpensive source of protein. So just, you may have to do some investigating on the ingredients. Okay.
I have a question online.
Collagen is a good source of amino acid that helps with joints and also cartilage. It's not necessarily a good source of like protein for muscle building. It helps with more of like some of the things that you need to help to support when you're aging. So some of that would be like, again, like the cartilage in your body or in your face, and then like joint cartilage. So it helps you support that stuff.
What about hair growth?
Hair growth is going to be more of like kind of like a B vitamin, or biotin is kind of a good source of vitamins for that. But biotin you can find in eggs. So have a couple eggs, and guess what? It's not going to affect your cholesterol. That's archaic information. So have a couple eggs on a regular basis, and you'll get a lot of good biotin for your hair. Okay. Who has heard of sugar-fed cancer? Anyone? Okay. Do I need to go through it then? You don't, right? You all know? Okay, I figured. Okay, so remember I'm just kidding. So remember I was talking about how protein helps with digestion of carbs? Like when you eat protein and carbs together, it helps slow your blood sugars, kind of slows that rise of blood sugars so that your body is able to manage those blood sugars better. Fiber and protein are essential for that. The reason why they say sugar feeds cancer is because all cells use sugar for energy. Every cell in your body. But of course, a cancer cell does everything to the nth degree. So we have now this like cell that's rapidly replicating like a Lamborghini. We have this one over here that's just a regular cell, like maybe at a Ford level. The thing that shows up more is obviously going to be the cell that's rapidly replicating. Okay, so when you're doing tests, they're going to see that one. Okay, that's where they got the sugar feeds cancer thing. With the PET scan, they give you glucose. It goes to the cells that are rapidly replicating. So it looks like it's feeding that cell. That's not so, okay? If you are eating a healthy diet that is rich in fiber, rich in protein, you're physically active, trying to get some movement, perhaps if your insulin is working well, you don't have any sugar issues, which is not the case always. You know, you could have diabetes where there's going to be some diet management that we have to work on. But in most cases, if this is your diet and lifestyle, sugar is not going to feed cancer. It's not going to Pac-Man its way to a cancer cell. It actually feeds all the cells. And if you're doing some physical activity after you eat, your insulin works better, okay? So it's definitely not a if-then situation. It's very complicated. Avoiding carbs naked. I had to put that in there. If you're eating carbs all by itself, that's called a naked carb. You want to get that fiber in, want to get the protein in, okay? Make sure it really is kind of the best way to develop a meal or a snack is to have both of those components. Okay, supplements. We've already kind of been talking a little bit about supplements with collagen and the hair vitamins. I will say most of the time, you really don't know what's in a supplement. They are not FDA approved. So that means that they don't have the support financially to kind of have the evaluation of how the quality of their vitamins. So I always say go with vitamin companies that have been around the longest. They usually put a lot more effort into the quality of their vitamins. These fly-by-night companies, they might not even have any of the active ingredients that they say they have in there. So you have to be careful, okay? In addition, supplements, because they're concentrated doses of whatever, can impact the medications you are on. Okay, so you do have to be careful there too. I will give you an example. My aunt, who has got cognitive decline, who also has high cholesterol, is taking a statin, has fallen for some kind of herbal supplement that has a bunch of stuff in it, including grapefruit extract, which she didn't realize. And you guys are giggling because you know grapefruit interferes with a statin. She didn't know that. Okay, so you do have to be careful in certain situations. Also, the studies have not kind of supported the use of supplements in prevention of cancer, except for vitamin D. It is important to take vitamin D. It is involved in so many enzymatic processes in the body. Okay, so I always recommend vitamin D. Get your levels drawn, check with your general practitioner. There might be a higher dose that you might need, okay? And then calcium, if you're not really good in terms of eating dairy products or calcium-rich products, you may have to supplement that too. Okay, and then if you are getting active treatment, again, you do have to be careful because there are certain herbal supplements and vitamins in high dose forms that can interfere with your chemotherapy or radiation therapy. Do schedule an appointment with a dietitian or the oncologist if you have questions. I'm used to it. We are all used to it. We have people come in with bags of supplements and we will go through every single one of them. Having cancer is a very powerless situation, and nutrition and supplements is some ways that people can kind of regrasp that power. They feel like these things are the things that they can do to help them. So we are open-minded to some of these things, and if they're not going to harm you, by all means. But if they are going to interfere with your treatment or medications, we'll let you know. We'll provide that education for you. Strong evidence supports whole foods first. That's true. Those colors of fruits and vegetables we talked about earlier, there's a lot of studies on what those phytonutrients do. And there's a lot of studies about how they work together. So like I said, the lemon and the green tea, they work together. There's oils in lemon. There's the antioxidant in green tea. They actually help each other with bioavailability. Okay, they haven't put those in supplement form. We have those in those studies of actual foods. Okay. Organic versus conventionally grown. I kind of do good, better, best on this too. If money is an issue and you can't buy all organic, you are going to get the compounds you need from a standard growth or standard growth and harvested plants. It's fine. But if you can get organic versions, they may have less pesticide residue. And then you want to think about what might have the highest pesticide residue. Maybe you don't want to buy all organic, but you want to buy some. Can't really scrub. Think about scrubbing a raspberry. Not going to be much left of that raspberry, right? you may want to get organic raspberries. Okay. What about a banana? Do we need to scrub the banana? Are we eating the peel? Exactly. That one can be standard, conventionally grown. Avocado, pretty thick, right? Pretty thick peel. Again, conventionally grown. Okay. If you want to buy all organic because it just helps you mindset wise, fine. But just realize you don't have to. Those aren't going to be the ones that harm you. It's going to be kind of those permeable skins like apples or the things you can't really scrub well, like this raspberries and blackberries. Make sure those are organic. You can look up online the Dirty Dozen and the Clean 15. They have a list of the most highly pesticide residue fruits and vegetables, and then the clean ones that have very little pesticide residue. Okay. If you want to scrub clean your fruits and vegetables, by all means, go for it. The ones that can be scrubbed. It does help to have a little apple cider vinegar into like a soap water, kind of helps with reducing some of the potential bacteria in those fruits and vegetables. Organic, in terms of like additives and chemicals, you do have to be careful with kind of the processed foods. You can get, this is where kind of the word organic can just be kind of a marketing word. So we could have organic Oreos, and really, are we doing a good thing here? It's probably still going to be a processed food. Look also for some of the additives, nitrates and nitrites. This isn't necessarily because of organic or conventionally grown, but it's found in a lot more of the lunch meats and deli meats and smoked meats. You do have to maybe reduce your consumption of some of these things. I always give a little bit more wiggle room when you're going through treatment because you need protein. Sometimes those cold meats, as long as it's pre-packaged, tends to be a little bit easier for people to tolerate. But if you are trying to reduce risk, these are things, nitrates and nitrites are a little bit more harmful for you. It is kind of a carcinogen. Food processing, other things to think about would be hormones and antibiotics. This is commonly found in dairy. A lot more often the cows are not being treated with these things, but there is typically something listed on the label if they have not been treated with hormones or antibiotics. Okay, has been kind of more of a concern for people who have hormone-based cancers to consuming some of these dairy products. And then the BPA chemical is found in a lot more plastic products. So reducing your use of plastic products, especially in the microwave, because you'll have a lot more of a concern. There's a lot more concern with that. I don't think a lot of people are doing that anymore. It's also found in liners of aluminum cans, and you can find aluminum cans that have a BPA-free liner. Okay. And then, of course, environmental contamination, mercury. You do have to be careful with like very large fish having a lot more mercury. It's good to have wild caught fish, wild caught salmon, wild caught tuna fish, and you can find typically on the can it'll say low mercury contained. Key takeaways: 80-20 rule. 80% of the time nourish your body, 20% of the time nourish your soul. It's okay not to be perfect. Okay? Thank you. Plan meals around fruits and vegetables. Move more. Avoid Dr. Google or ChatGPT lately. Right? Eat your foods with eat foods that your great grandma would recognize. Use relaxation techniques more often and breathe, and practice good sleep hygiene. I know I didn't talk in depth about that, but that is also important. Thank you. Any questions?
Some online. Is there a link between collagen and tumors or tumor regeneration?
You know, I can't say yes or no to that. The studies are pretty small still in terms of that. I have found many research articles that say have zero risk for tumor regeneration, and then there's some small studies that, depending on the cancer type, it can influence tumor regeneration. So I am not 100% on that one. I will admit, collagen and tumor regeneration. I know that they're kind of moving towards more like saying that it's safe. I think that there's a lot more conservative oncologists out there, and if you don't feel like it is something that you feel safe consuming, don't feel like it is like the magic powder for you. You don't have to do it. You can get collagen in protein-rich foods. That's where it's from. But from a safety standpoint, I can't say 100% as of now, not yet.
The other one we had is, of course, the scientific word seems the soy that will tell you this process, and then, Bart asked to come to me, spell out, or maybe the break it down.
Yeah.
You
So soy protein isolates, that is the word, those are the 3 words I tell people to look for. Soy protein isolates,
as a good
bad. That's more of a processed soy. Yep. Okay.
And then the last question, do you have any latest research or knowledge on taking CBD, acidic or clean?
That is definitely not, it's a very promising field using CBD for those things. It's not something that's in the nutrition research as of right now. It's going to be more of something that you would talk to with your oncologist, providers, or palliative care provider is probably the best way to get information about that, because they are more knowledgeable about CBD. The question was CBD and sleep and appetite and things like that. I would probably go more with kind of like a palliative care provider for that.
One time, after what we do for most, so we can experience.
That I would have to look into that one, like specifically. Like that would be something that isn't common. It's not something that I commonly see with my chemotherapy patients. So it would have to be like me looking at that chart and looking at what other things are going on with that person and why they have sodium that's low. Yeah, absolutely. Please connect with the dietitian and find things, because there's a lot of different things that can impact sodium.
Anyone here have any questions? We have maybe 1 more minute.
Ask it now.
What about protein powders? Are they, I would assume they're processed, are there any that are safe, so they're good?
Question was protein powders, if they're safe. Are they processed? I think some of them are processed. But if you find whey protein powder or chickpea protein powder or pea protein powder, those are typically fine. It's when they are isolated proteins that means that they have taken and derived the protein out of something else and now are putting it into something else. But if it says whey protein powder or chickpea protein powder, those things are generally better. And I would just make sure that it doesn't have a bunch of fillers and other things in it. So look at the ingredient list. Again, people do to add lots of sugars and different various like colors and things like that in some of the more processed protein shakes or protein powder, especially if it's marketed as a protein shake, there might be added things. But if it's just straight up protein powder, like Bob's Red Mill is a great company. Have anyone heard of Bob's Red Mill? They have a whey protein powder and it's just whey protein powder. That's it. And it's unflavored. So if you want to just dissolve a little bit, put it in water or milk, add it to your oatmeal or add it to your shakes, you're not going to even taste it. And that's a good company. So I always recommend that. Plus it's not a huge drug like this. It's just a bag. So you don't have to be married to it. You can just try it out. Okay.
And so now we have, I guess I can move it too. We have Claire Paulos, who is with Survival to Strength, and Claire is a certified personal trainer, registered nurse, and has certifications as a cancer exercise specialist and physical activity with lymphedema. So really excited to hear from you. So
We can take a short break if you need to.
no, I think we're good. Yeah.
Awesome. I'm just gonna.
Oh, sure.
Oops.
Set up.
Do you need any time to set up, or is this good? No. Okay. Awesome. And just that arrow.
We're gonna talk today a little bit about benefits of movement, how much movement is enough. And then hopefully get some good discussion on different ways to be more physically active. Sarah's wonderful. You really cannot talk about wellness and just talk about movement. You have to talk about nutrition and rest and recovery. And mobility and balance, when I say mobility, I mean range of motion. Mobility and balance are the foundation for cardiopulmonary, your heart and lungs, and strength training. And sometimes when people join our program, they get a little frustrated because they say, I come 3 times and I haven't touched a dumbbell. But you really have to have mobility and balance as a foundation for strength. So what are the benefits of movement? Most you already know, reduce illness and death, reduce anxiety, reduce depression, less fatigue, pain, and there's quite a bit of studies with lung cancer showing how breathing exercises and different types of exercises reduce shortness of breath for a lot of reasons. And the most basic reason is that it makes your heart and lungs more efficient. So even if you've lost a lobe, you've had a lobectomy or a pulmonectomy, what your heart and lung lobes left can become more efficient. And then you sleep better and you think better. And there's an emotional component to this too. When you have a cancer diagnosis, for most people, that's very scary and traumatic. And so when you're physically active, that can help reduce that stress response that we have. Sarah talked about stress being inflammatory, and it is. And when you, even later after you've had your diagnosis and your workup and you don't know how the treatment's going to go, even years later when things remind you of that, or maybe you're going in for your annual checkup and you're in for your CA 125 or your PET scan, you can again have this huge stress response. And physical activity can, at the cellular level, counter that. And then there's a lot of physical, obviously, benefits for this. Sarah touched on this a bit, which is so important. It regulates your protein, how you use your protein when you contract your muscles. You can eat all the protein you want, but if you don't contract your muscles, you won't build muscle growth. But it also is so important for all the functions in your body. And when you're physically active, that helps you use those proteins better for all the different things that need to happen in your bodies.
That's neat.
That's okay. That's right. And it helps you regulate your insulin and sugar so that you can use your insulin and sugar for more energy. And it helps with digestion. There's been some studies that show that when you're physically active, when you move, your gastric emptying time is short. So so that helps with nausea, and it can help with if you're having trouble getting enough nutrition, it can help you with your appetite. And there's studies that show, particularly what I'm thinking of, there's not with cancer, but it showed when people are physically active, people who have Crohn's and inflammatory bowel disease, that the movement, when they do movement, it helps calm down the lining of their intestines. And that's inflammation in your intestines is a huge problem. You've had a cancer diagnosis, chemotherapy, stress, some of the targeted therapies, immunotherapies can cause a lot of inflammation. And mechanically, it can help with constipation just by moving your body more, helps your intestines move. So there's been quite a few studies with lung cancer that show there's fewer surgical complications if you have prehabilitation, which is getting ready for treatment. Breathing exercises, range of motion exercises, or people are discharged from the hospital sooner with less complications. And then, of course, rehabilitation afterwards. Quite a bit of studies with lung cancer that show people have less complications long-term, years later. And when you had abdominal surgery, you were at increased risk for herniations. And so working your abdominal muscles before and after surgery can help prevent hernias. And of course, breathing exercises, but all movement helps clear the mucus from your lungs, which decreases the risk of infection. And for a lot of people to do 5 minutes of just breathing exercises is a lot of work. Some people take months to build up to just doing 5 minutes of breathing exercises. And you might think, well, why is it? It's just breathing. But when breathing, the muscles used for breathing Some of those are also used for moving their neck, moving their shoulders, moving your back and chest, your core. So it's a lot more work than you think. And there's a deep abdominal muscle called your transverse abdominis. That's very important. It's like a cummerbund goes around your waist or like a girdle. And a good way to keep that strong is breathing exercises. And that muscle is so important because it does help with breathing, but it also stabilizes your spine. So that's one of the reasons why breathing, we're really going to kick out with breathing exercises. I'm pretty excited about that. And what is a breathing exercise? Sorry, what is a breathing exercise? Oh, there's all different kinds. There's expiratory, inspiratory. There's some that you move like that. All kinds of ways. And I even have people breathe wrong sometimes. Raise up their shoulders and open up their rib cage. And all those things open up your airways. And like I said, you do all these different muscles. And there's a study showing inspiratory breathing exercises can lower your blood pressure. And hypertension is a common problem in the general population. And it's a common side effect of targeted therapies to have elevated blood pressure. Plus, when you're stressed, under stress or anxiety or fear, that raises your blood pressure. So just doing inspiratory breathing exercises can lower your blood pressure. And I'm a big foot lower leg person as far as physical activity goes. I think people forget about their feet, but contracting your calves, moving your ankles and feet can help reduce swelling in your legs and feet. Your lymph system and your veins, they run parallel with each other, and they don't have muscles to pump the fluid out. But when you're contracting your muscles, your calf muscles and feet, that is how the fluid gets pumped out. So it's very important. There was a study done with some wound nurses with people who had diabetes and had foot ulcers. And the people that did the foot exercises, their wounds healed faster than the people that didn't, because it just helps with all of the circulation. And it's safe with lymphedema. There's been a lot of studies with lymphedema, as long as you progress carefully. Just like Sarah said with fire, same idea with physical activity. Just progress slowly and carefully. And when you've had radiation, surgery, sometimes tumors, you can have obstructed lymph flow. And like I said, the lymph vessels are all through your body, running parallel with your blood system. And when you've had chest surgery, abdominal surgery, that can obstruct some of the flow. Also, they often remove lymph nodes which filter it. And then also, if you've had abdominal surgery for ovarian cancer, then you may have had your greater omentum removed. Your greater omentum is like a apron, and it actually has a lot of immune cells in it. So not to sound negative, but with those surgeries, radiation, you do have a decreased immune system. But the good news is physical activity can boost all of that. So it can counter a lot of symptoms and side effects. Fall prevention is a big thing. You might have chemotherapy might cause neuropathy, surgery, radiation cause neuropathy, maybe brain tumors or vision or ear conditions. And our brain has a thing called neuroplasticity, which means it can learn new ways of talking to your body and from receiving messages from your body. But it takes practice. When you practice movement, your brain learns these things. And so there was a lady I worked with who had lung cancer, and she had a tumor in the upper part of her back on her spine. And I met her, she was 5 years free of disease, but because she had that tumor on her spine, now one of her legs was not working right. And she worked with physical therapy, and I worked with them. Her goal was for her to walk well enough to shop with her daughter. And she was having trouble even with the walk. But with lots of practice and careful progression, she was able to use her leg well enough to walk if it came. And then fall prevention also from disuse condition. Disuse condition is a term we use in nursing and physical activity for if you simply don't move much for a while, which happens a lot after surgery or if you have an infection, things like that. So then your brain gets sort of out of practice from talking to your body or from receiving messages from your body. So just decrease neuromuscular communication. But again, just practicing those movements, you can regain the coordination that you may have lost and maybe even better in alternate ways. And then it causes stronger bones, particularly if you start treatment younger. Even men are at risk for osteoporosis or thin bones, and physical activity helps make your bones denser. It helps make your joints more flexible, your ligaments and tendons more flexible. And your joints have a kind of gooey fluid between them called synovial fluid that lubricates them. And you always have it there, but when you start to move, your body makes more of it. So it's more lubrication. When I'm working with people, I have them always start with breathing and range of motion, get that synovial fluid going, making their joints move better. So moving your joints makes your joints move better. And then of course, independence is so important to develop strength and power, to regain strength and power. When I say power, that is strength with movement. You need power to walk up the stairs or to stand up from a chair. And so we want always to be developing that so that you can stay independent with your everyday activities. And Sarah talked about immune system, can't say enough about it. There is so much good research, showing how physical activity boosts your immune system. Your body makes cells that fight cancer and fight infection. And when you contract your muscles, you make more of those. And you also make cells and chemicals, proteins and chemicals that are anti-inflammatory and cancer resistant, meaning they don't kill the cancer cells, but they make your body environment unfriendly to cancer cells. And you make more of those when you contract your muscles. This is my friend Renee. She's had ovarian cancer twice, and she had a part of her lobe of her lung removed, and she is doing amazing. This picture was taken 10 years ago, and she's doing great. So one thing I've learned from all of you is how important confidence is with physical activity. I really did not appreciate this when I started Survival Strength 12 years ago, but people don't know their bodies anymore. You've had so much change in your health, so much change in what you're able to do. And when you practice movement, you're not just getting healthier, you're getting to know your body better. Okay, today, maybe I can't walk the dog today unless someone else holds me. So today I can walk the dog. You get to know your body day by day better, what you can do. And the other thing I learned, I'm happy to say, is that most people can do more than they think they can. So how much is enough? Sarah talked about this, where we do 20 minutes of resistance, and this is the recommendations. But the fact is that, Sarah, I love how you said good, better, best, because that's exactly right. Most people are not able, for a variety of reasons, to do what is recommended. You can, great. Most people can't. So what is the minimum? The minimum for benefits is 30 minutes of moderate activity most days. And that does sound like a lot, but we'll talk about that. And it's a 20 to 40% reduction in all illness and death. I mean, it is more important than not smoking. So how much is enough? Today, enough is what you are able to do today. You set your goals for the day, for the week, for the 6 months. There's a lady I work with who her goal was to be able to walk down the aisle with her son when he got married. And I met her in January, and her son was getting married in July. And she was not able to do any type of vigorous or even moderate exercise. She had brain mets and some other things going on, and she needed to just do minimum movement. And she did great, and she did very well walking down the aisle with her son 6 months later. So light physical activity has benefits. And isometric is a type of contraction where you tighten the muscle but you don't move. There are ways that is light physical activity that is really good for you, and that also lowers your blood pressure. Different poses and isometric exercises, which some people consider that light physical activity, but it isn't always. This gentleman is doing a isometric exercise, a wall sit. His knees are at a 90-degree angle. That is not easy. Many people will never be able to do that. When I work with people starting out with the wall sit, their knees are barely bent. But still, they're getting the benefits of isometric exercise, of mild exercise, because they're going to push their feet down into the ground, build tension in the abdomen, little tension in the rear end, shoulder blades down and back, and then just hold it. And that still will lower your blood pressure, and it also will help develop your stabilizer muscles. This other lady's doing a low plank, again, very difficult. Many people will never be able to do one, and that's okay. The lady below her is doing a tall wall plank, same benefits, again, just by holding your muscle contraction. And you have muscles in your, particularly in your pelvis and spine, that are designed for stabilization. And so holding them develops their ability to stabilize. And like I said, that is the foundation for strength and for movement. And it lowers your blood pressure. There was a study that showed that just standing, just a little bit of muscle contraction for standing, people made, it was actually some women, and they made more myokines, which are a chemical that's anti-inflammatory, and cancer cells don't like it. So just standing makes a difference. Increasing your resting heart rate, 20 beats above your resting heart rate. You can do that for 6 minutes. Things shift in your body. So you start using your sugar, fat, and protein in healthier ways. And recently there was a study that showed, okay, what is a minimum strength training I can do to get any good? So resistance training with a dumbbell, fan, machine, or in some cases body weight. 6 to 12 repetitions with a weight, band, machine, 4 sets a week. So for example, I want my bicep to stay the same strength or maybe get a little better. I'm going to do 8 sets. So 8 repetitions. And maybe my last 7th and 8th repetition is a little bit of work, but I can keep my form and it's not too much work. I'm going to rest a minute, do 8 more. And today is Tuesday, so I'm going to do that again on Thursday. That is enough to maintain or strengthen your muscles. So this is all really encouraging to you guys, because there's so much good for even moving a little bit. So what is light, moderate, and strenuous? It's individual and it's different day by day. I like the talk test, what Sarah mentioned. Light is it's easy to talk. Moderate, you're able to talk, but you need to take breaks from talking. And strenuous, you're not able to have a conversation. If you're physically fit enough for strenuous activity, that is great, and you should do it. But most of us are not, and you don't need to be, because there's more studies showing now that consistent light to moderate exercise and movement has more benefits than infrequent strenuous workouts. I was listening to Sarah Kovacs talk earlier this winter, and she said something I love. She said, barriers are not failures. Sometimes when I'm working with people, they criticize themselves. Well, I didn't do any physical activity the last 2 weeks. Well, maybe they had a PET scan and blood lab draw and all these other things, or maybe they just weren't feeling that well. So I just can't emphasize enough how barriers are not failures. And everyone has barriers to being physically active. Once you've had a cancer diagnosis, you have even more barriers. So don't beat yourself up about that. I tell people, help yourself to an exercise snack. That's a term in the physical fitness discipline, where that you just do something you like for 2 to 3 minutes. Some kind of movement for 2 to 3 minutes, not scheduled. And for instance, if you're doing the dishes and a song comes on, you're like, just stop and do a little boogie woogie for 2 to 3 minutes. It's really good for you physically, it's good for you mentally, and it's just another way to get some movement in. And get real creative for how to remove barriers. Maybe your barriers are, you don't know how to use Zoom, you don't have the right shoes, you don't have a ride. Talk to your support systems and say, hey, let's try to get rid of one of my barriers. And then don't forget that yard work and housework are moderate activity. And for some people, they're strenuous. So that's all counting towards your 30 minutes. And I attend an online class, online movement class. There are studies that show whether you do movement at home, online, or whether you go to the studio, same benefits. So whatever works for you. So saving time and energy, there's different ways to be efficient with movement. Remember that, for instance, when I work with people, we do breathing and range of motion to warm up. So you're getting some of that as part of your warm up. And you're also doing breathing and range of motion throughout your workout. If you're doing rows, you're doing range of motion and breathing. And if you're doing Pilates, all those, they all teach you to incorporate breathing and range of motion. So you're getting some of that in. And also to be more efficient just with time, sometimes you can incorporate some of your strength and balance work in with some of your aerobic work. For instance, there's a lady, I know who her door for her apartment is a ways from the elevator. So she walks down this narrow hall for exercise, and when she's leaving, and she will stop and take a break, hold the wall, and work on her balance. So she'll stop and, thanks, Sarah. She'll stop and do a wall chest press. So she's working some balance and strength into her aerobic. And I like parks. Parks are set up in Minnesota a lot of times with benches and places to stop to do things. So think about that, benches to rest, but also to do some isometric strength moves and balance. And then sometimes if you are in a gym or using different things at home for machines and cables, you can get some stretching in with that machine. For example, when someone's doing a cable pull down and they're going to do 8, when you get to your 8th one, don't let go, just hold the machine and just let it stretch you. Let it open up your vertebrae, stretch your chest and back and shoulders, and just relax and let the machine do the work. That might add 30 seconds longer to that exercise, but you just got a really good stretching. And then stairs and ramps, they're a workout. And so sometimes, we tend to go up them with the front of our feet, which just uses our quadriceps, and not great for our knees. So start thinking about getting ready to move before you go upstairs and ramps, or always hold the rail. But get your shoulders down and back, little tension in your abdomen, push your feet down on the ground, and use your whole foot, including your heel, to walk upstairs and ramps. And that way you'll use your hamstrings and all your pelvis also. And so that is a different way of being even more physically active than something you do all the time and more stable. And then you can go up and down ramps and stairs sideways for your side motion and hold the rail, because we tend to do everything just forward. And it's good to move in all directions. Think about different ways you can just work it in with your daily life. If you're standing in front of the microwave or in a line, that is a good time to do foot rocks. Push your feet down and out. Sounds silly, but it's such an important thing to get good at. Shallow squats. And if you're sitting in a car, sitting in the waiting room, you can do ankle circles, thoracic twists, chin tucks, pelvic tilt. And don't worry about what people think of you, because if someone sees you doing it, they're going to think, I should be doing that. That's what they're going to think. And a lot of us have individual monitoring. These can be really good. That motivates you and reminds you to do things. I like that you can set them to remind you to breathe and to just move. This is a couple that both of them have had cancer, and they work out together, and that saves time, because it is hard to find time to see all the people we care about. So if there's some way you can be physically active with some of the people you care about, that builds relationships while you're getting healthier. And try to get creative when you need to do something that you don't like to do. Say there's 2 physical therapy exercises that you need to do that you really don't enjoy. Maybe going outside or calling a friend and saying, hey, let's FaceTime on, talk me through this while I do this at 10 o'clock Saturday morning. And music, can't say enough about how relaxing music and how peppy music can really be powerful. When you're not in the mood, you're just not up for it to try. And then TV is notorious for encouraging sedentary lifestyle, but you can use it as a tool. For example, you could take an exercise snack. You can say, okay, I'm going to watch my favorite show, but when the first commercial comes on, I'm going to do my neck and my wrist exercises, and then I'll relax for the rest of the show. And prioritize fun. I know all you've heard about physical activity, you always hear us say, it's so true. There's so many ways to move that are fun, that are not structured workouts. And just think about doing more of those. So I've been talking a lot straight through about how much is enough and things like that, but I really would like to hear from people, how have you removed some barriers? What has helped you incorporate more physical activity? If there's any questions and any ideas about that, would be great.
Yeah, question. You definitely motivated me to want to go to the more moderate. I walk my dog all the time, but I walk my dog with an audio book, so I can't do talk tests. What would be a heart rate? How do I know if I hit? I tend to be plotting. How could I monitor myself to be is there a certain amount of heartbeat above my regular pace? Did you say?
If you just raise above your resting heart rate, just 20 beats. Yep, that's that.
And maintain that.
Yep, for 6 minutes. That things start shifting. Okay. And it's just how you use your sugar and everything. So it's shifting. And I tell you, maybe it's hard to say because sometimes there's weather factors, but if you start breaking a light sweat, your body is shifted into and help you. Yeah. Does anybody have any ideas about how to add more physical activity?
Well, I have, you talked about monitoring devices. I have an Aura Ring and Apple Watch, and they kind of work together. And because I didn't even know that my vacuuming was increasing my heart rate, and it would show up as, so many minutes a day. And, sometimes it says, oh, you were yard work or vacuuming or what? And the other thing that I do, you said something about dancing around, and so I do that some, but one of the things I really do is shaking, and that is just and I do it to a song that's like drums and stuff, and I do it toward the end of the song. And so you're really kind of supposed to do it for 5 minutes, for your mental health and stuff. Like every morning, they have people who've been through trauma. That's what they recommend. If you've been through a trauma, that you can do shaking. Yeah, just shaking out. And it's kind of fun, and they have kids around. Oh my God, they love it. And what I found, so I teach real fast. And we do that in our yoga class, and we do, 20 minutes. And then, and what I found, it showed up on my Aura Ring as the highest level of exercise. So it was that HIIT, where you have, where you have really, and it's not hard, but you do get your heart rate up. I can tell that I'm doing that. And it's really quite good.
That makes me think of, we talk about slow twitch and fast twitch muscles, and you need to keep your fast twitch muscles awake to have power, because power is moving with resistance. And twitching is a great way to keep fast twitch muscles going. Yeah. I mean, that is fabulous. Yeah. And so is ping pong.
Yeah. And actually, somebody even said that you know, people that bounce their legs, like I said, she like bounce, 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 bounce. Shaking the whole house, but it actually, it is giving you some exercises. Thank you. Yeah, and if you want to do yoga, the free, it's going to be at Lake Area, and I'm teaching on 2 weeks from Sunday at 8 a.m. And
It is in the parks.
it is by the band shell, so it's kind of in between the lake and the band shell, and just, you know, come, and I'm gonna try to gear it for beginners anyway, but, you know, there's a lot of people that are, so anyway, and I would love to know it if you come, and then I can kind of, you know, try it. It's fun.
Yeah,
And we will be shaking. And doing some other fun things. Another thing we do is we balance. We do like tree, but we do it in a circle with everybody's, you know, have your hands with something touching the next person. So it's a lot easier to balance with, you know, that circle.
Yeah.
And
Questions, are you ready to that? Sorry, there's one that was, I've been active in public, considered after surgery, you know, recently I've developed, edema and playing other specific exercises that, help or anything I should avoid. This person's hurt, cycling, and doing the same training with my
That's a great
Can you
question.
repeat the question too?
Oh,
for people
so
online? Yeah.
a person is very physically active, and she's recently felt lymphedema in her legs. And one leg, and that's a really good question, and it's because what lymphedema in your lower extremities is different than in your upper extremities, just because of gravity, for one thing, just like what I talked about, pumping the muscles. And so it's always recommended that you wear a compression garment. I will have to, let me get back to her on that, what is okay to do, because the last time I worked with the lymphedema group was about 5 years ago, with lower extremity. So I'm sure that there's more with that. And the only thing that I know about the top of my head, but I'll get back to this, that would be a contraindication is just to progress too fast, because you don't want to overwhelm your lymph system. So you need to progress your movements and strength gradually. So, yeah, I'll get back to that.
is there some kind of lymph massage?
Yes, manual lymphatic drainage.
Yeah.
I'm sure she's already seeing someone for that. It's a very gentle type of massage that it's not a regular massage therapist, and physical therapists, OTs, and then other people also have that. And so I'm sure she's receiving that also. But as far as any contraindications specifically for lower extremity, I don't know of any right now, and I'll check out about it.
And then she had a follow-up question about the risk for murder. Is it beneficial? And then
I don't want to say cost, and I'm not a Pilates instructor, but my experience with Pilates and knowing many people going through Pilates for years is a great foundation for strength, just like yoga is. I mean, that's where you really get your breathing and your posture. I will say, back to your first question, and I know of two. I used to be a competitive powerlifter, and I know of two women who had lower extremity lymphedema who were competing in powerlifting. So I'll check into that, and then I don't know the price of reformers, but you could probably get them used also.
What is it?
Reformers is a type of machine. It's a cable machine that's used for Pilates. You know, you can have Pilates just on the floor mat, but mostly it's in the. Can anyone speak to that better than me? Anyone in a Pilates class? Well, Pilates was designed by a man to help heal injured ballerinas, and it's great. It's great for range of motion. It's great for core. And it's great if one side of your body's lopsided compared to the other. So.
And then there's another question. Do you know anything about if the Y offers free programming?
There was a lot of Livestrong programs, which were wonderful. And there was even one that was one-on-one in West St. Paul. I will check into that again, but right now I don't think there are any in the metro area. At the Wise, but request them because I bring them up when I go to Wise, as soon as I work with people in Wise, and bring it up because they'll start it again. And there is another program in Eden Prairie that's been around for a long time. It's a small group class and they have great trainers. So that's been there, I don't know, more than 10 years. That's another option.
Can you share about survival to strength for those who don't know?
Survival to strength. I started as a volunteer about 12 years ago, and then we got more trainers and made it a 501c3 in 2014 because insurance doesn't cover education for physical activity. It's getting better. Sometimes you can write that off on your health savings account now. And I'm hoping that in the next few years, it'll become part of the treatment plan. Physical therapy, when I started this 10 years ago, you could not find a physical therapist that specialized in oncology. And now they're everywhere. And now oncologists are referring to them. And so I think it's getting better. But anyway, so we right now we're short 3 trainers, but we do have funds and trainers for free strength training. So please let me know if you're open and we'll try to get you set up.
And I'll drop a link to yours in the chat. And then do you know the name of the very that
I can get back to you on that. It's at the Eden Prairie Community Center.
Yeah.
And it's cancer survivors. We have to have a membership to the community center, I believe. For me, I have silver sneakers, so I can go for free. But they meet, I think it's on Tuesdays and Thursdays in the morning, like around 10:30. And one of them focuses on more strength. And the other one, I think, when I went, we did Tai Chi. But I think they mix it up too.
Yeah, it's a pretty good program, good trainers. Thank you.